Well, the lack of communication between the Victorian government and the Federal Health Department has been revealed at an estimates hearing, with senators told the federal government is often left to find out information on Twitter. Live to Jonathan Lee in Canberra. Jonathan, eyebrows also raised over vaccination rates within aged care particularly.
Yeah, Tom, good morning to you. It's been a frustrating estimates hearing, especially for the senators, the Labor senators asking questions as they try to press the point about the slow vaccine rollout and ask basically how many people in aged care, both staff and also the residents, have actually received the vaccinations. I'm going to play you a series of grabs and exchanges here between the senators and those answering the questions. Richard Cole.
Can I move to vaccination? So how many aged care residents in Victoria are yet to get their second dose of a COVID vaccine?
Senator, I don't think we have in front of us the numbers of residents. We can say that 85% of residents have consented on average, I guess, across the country as we've been going around doing the vaccinations.
Okay, so how does the Commonwealth attend estimates and are not able to tell us how many residents in aged care have had their first dose of vaccine or their second dose?
Eventually they got back to them with the answer, Tom. In the meantime, they were able to provide the information that there are 183,000 people in aged care across the country. 153,641 of them have had their first jab. Around 116,000 of them have had their second jab. They were eventually able to break down the information as to how many people in Victoria had had that. The information, though, had to come via a text message.
44,333 total residents have been vaccinated in aged care in Victoria, and that includes 25,319 who've had a second dose. It's also important to note that people decline to take vaccination in aged care for a number of reasons. One, because they're not comfortable with the vaccine for some reason, but also there are people who are ill at the time or who may be approaching end of life and they or their families decide not to have vaccination as an additional intervention at that late stage of their life.
There was also clearly some frustration from the Health Department and the government, Tom, when they were asked when they found out the information, the latest statistics from Victoria. They made the point that they didn't find out that information until roughly 9 o'clock each morning, not via a telephone call, but via information which was posted on Twitter. Once they had that information, they then learned how many new cases there were each day, but it seems they didn't get access to the Chief Health Officer in Victoria often until after Victoria themselves had had a press conference. They seem to think or accept that that was just the way things were. They say it's been that case since the second wave in Victoria. It seems, though, Tom, to be different from how the other states are managing the crisis. Tom?
Yeah, so they're apparently finding out the way the rest of us are. Jonathan, thank you.